Welcome, everyone. We're so happy you're here with us. We're going to be answering your Q&As. Ask us anything about peptides, plasmapheresis, cutting-edge therapies, and pop those questions in the Q&A. We're going to start with some questions from ones that were sent to us in advance. Someone's asking, can plasmapheresis be verified via cell micronutrient array? I'll have you answer that, Aaron.
Yeah. Well, the CMA really looks at, minerals, and so that's not something that necessarily is going to change quickly with plasmapheresis at all. Plasmapheresis is going to remove toxins and inflammatory chemicals. So it's really not directly related to the CMA testing, the micronutrient testing. Obviously, when the toxins are removed, and if you continue to have good intake of nutrients, yeah, that's going to get better. But usually, the thing I always want to remind people that when your micronutrients are off, it's usually an inflamed gut that's at the issue with there. Because when there's inflammation in the gut, you actually cut down the absorption of the trace minerals, and if the trace minerals aren't good, then your vitamins, even if they're there in the blood, aren't going to be working well. So this is a long story that we're going to, I think, in our next episode, next of the Gordon Medical Forum, we're going to be talking to a fellow named Joshua Leask, and we're going to go into details about how important gut inflammation and trace minerals are for your health.
Mhm.
So the short answer is no. Plasmapheresis is not going to change. You're not going to be reflected quickly in the cell micronutrient
I'm going to
testing.
jump in right here because I think it's really important that we bolster up your nutrients, your micronutrients, your minerals, your amino acids, your antioxidants. These things are important to be bolstered up prior to any detox, whether it's plasmapheresis or intravenous cellular detox therapies. But you are going to see celebrities doing one-off plasmapheresis, holding up their bag, right, full of the toxins, and it's just going to be a one-off or maybe two, uh, without much other therapies around it to actually support the plasmapheresis. So when you ask that question, I can't help but think about, well, what else do we need to do to be supportive for plasmapheresis? We need to have appropriate micronutrients on board to support that detox process. Because if you don't have the appropriate micronutrients on board, toxins are just going to recycle. Not only that, but there are many other supportive therapies that need to be done for plasmapheresis. So the labs are important. That lab that you asked about is very important to look at before we do plasmapheresis and during a certain set amount that you're going to do to ensure that your system stays supported while we're doing that therapy. I'm going to jump into the queue. Do you want to say anything else
Yeah,
about
well,
that?
just to add again is that the plasma, as well as Nafysa was saying, is that plasmapheresis is part of a program. It's for if someone has any kind of chronic health issues, it's not a one-off fix it. Okay, it's just part of a program. It's really important in some people to allow you to get to the next level or to allow you to tolerate other therapies, but it's not going to make you all better. So I just want to emphasize that.
Okay, so someone's asking, just while we're on the topic of plasmapheresis, someone's asking, isn't apheresis safer than plasmapheresis?
Well, I think they're talking about different things. There's something called ionospheresis, which is done in Europe and hopefully will be here in
Yeah, but
2027.
apheresis is the same thing as
Yeah,
plasmapheresis.
it's just the name. I mean, this is confusing. There's lots of different terminology, but yeah, but generally, apheresis is the global term, and plasmapheresis we're using albumin to replace, and albumin is safe. It's not something I want to take a long time here, but there is no spike protein in it. I have checked. And yeah, and I've also checked for toxins and I've gone deep into the way it's produced, and it is safe. There's no prions or other things that people are worried about. We've been using it for, I mean, well, I know for at least the last 30 years that I've looked back, there's no problems with it. But anyway, but there's lots of concerns, and that's a subject for another time. So let's hit some other questions. Let's see.
Okay, someone is asking if there's a general detox peptide that would target mycotoxins. Dr. Holtorf and I gave a webinar together last week about this very topic. Okay, so the topic of serous treatment, the standard way of treating it versus the way that we've been thinking about this using peptide therapies, it's quite different. I would suggest that you listen to that webinar. It'll be posted on YouTube at some point in the near future. Um, if you don't already have that webinar, there's a long answer to that. It's in that webinar. Um,
Okay.
Best MCAS peptides. So I've given a lot of webinars about this one as well. I've thought deeply about peptides for MCAS because most of our patients have that. So I actually like to start with lorazepam because that helps to seal leaky gut in a much more efficacious way that I've seen clinically than other substances to seal leaky gut. Once we're sealing leaky gut, that prevents the mast cells that are released in the gut from passing through the gut, right? Through leaky gut. So, or crossing the blood-brain barrier or ending up in any other system of the body. So I like to start with lorazepam. Amlexanox is a mast cell stabilizer. KPV is also a mast cell stabilizer. So I'm using those, and I'm also adding in other medications as appropriate for the patient dealing with MCAS, maybe cromolyn or ketotifen or low-dose naltrexone, for example. Someone is asking, are there peptides to help with anxiety? C-Lank is it helps with brain inflammation, but it also helps with anxiety. C-Max as well. GHKCU, it I use it to help with connective tissue, with support for connective tissue, and it also has anxiolytic properties.
Let's see.
Someone's asking about Athena. Hello there. She's asking about efficacy of SS31 in MOTS for CCI patients, what we've seen clinically. What I found novel, adjunct therapy for improvement to mobility in addition to TB4. Athena, I'm going to answer that question. So what I found novel for patients with CCI is GHKCU, so giving them having them do an injection subcutaneously, but also giving them a GHK cream, also GHKCU injected subcutaneously has helped significantly when patients might have a surgery with Dr. Bolognese, just stabilizing them prior to that surgery. SS31 is going to help with the mitochondrial membrane. It's not stimulating the mitochondria like MOTS-C is. So with patients who have chronic fatigue syndrome, if we're giving them MOTS-C early on in the game, it's stimulating the mitochondria. Typically, they're stuck in stage one of the cell danger response in oxidative stress and persistent inflammation. So I'm not wanting the mitochondria to continue doing that. So MOTS-C for these patients later on. TB4 also does help with tissue regeneration, not as much as GHKCU. So I'm giving GHKCU and then TB4 and then MOTS-C later on. SS31 can come on earlier because it's not stimulating the mitochondria, it's healing.
We seem to have a lot of peptide questions. I'm just looking.
Someone wants to know how long they can use BPC 157. It depends on you. Some people a month, some people a year. It depends. So you really want to make sure that your patient, your doctor is monitoring you on this.
Okay. Let's see. It's it's it's
It's
peptide. It's all
peptide day,
peptides.
yeah. Does
Peptides
BPC
day.
157 also seal leaky gut? It can help with that, absolutely, but lorazepam is better. When you put them together with the patient, that's going to help even further with leaky gut. This is this is all peptides, yeah.
Yeah.
It tells me what our community is interested in.
Yeah.
We're going to provide you with more peptide information. Clearly, it's what you want. So, you want to
Yeah.
answer some, Eric?
Well, no, I always say I use the peptides and I'm always interested in them, but I always find that there's so much more to know about them that I I hesitate because there's a question here about, peptides to help ischemic changes and atherosclerosis of the heart.
Okay, so
And
you know what? If you've got ischemic changes in atherosclerosis of the heart, you need your cardiologist, but the blood vessel bioregulator could be helpful. It's not going to heal the whole thing, right? When you've got a disease like that, you need a multi-pronged approach. You need your cardiologist on board. But the blood vessel bioregulator could be helpful. TB4 could also be helpful.
yeah. One person, here's a general question. Is there a list of general side effects for peptide use? And the answer to that is, you know, uh, not really. I mean, for the injectables, it's always, some people will get a little redness around the injection sites. But really, it depends on how your body interacts because um, when people don't have any tendency towards mast cell and their immune systems are working well, I've never really seen really any issues with the peptide. So it's just as people get more inflammation in their body, then your biochemical individuality starts coming up high. And so you can have these idiosyncratic reactions because parts of your immune system are a little upregulated or downregulated. So when you add a peptide, that is going to stimulate one part of your immune system. If you don't have the balance right, yeah, you're going to have a problem, but a minor problem. I mean, again, so start slow and go easy. But I don't know any general list of things
Of
to
side effect,
side
I mean,
effects.
the thing is, you want to make sure that you're using peptides that are coming from a compounding pharmacy. If you're doing injectables, orals, the only orals I trust are from integrated peptides or from the compounding pharmacy. Peptides you're getting from just over the internet. You don't know what's in them as byproducts. You don't know if they've gone through a particular washing process, purification process in order to make them bioavailable. I have a doctor friend who once found mercury in peptides that a patient had purchased online. So there can be all kinds of side effects if you're purchasing something that's not from a compounding pharmacy. Um, okay, one second. Someone's asking what lab we mentioned for
Oh,
micronutrient
well,
testing.
there are several out there. Cell Sciences, SpectraCell. Um, there's a device called the oligoscan, which I'm been looking more into lately. It's been around for a long time. I always thought I wasn't too sure about it, but as I'm doing a deeper dive, I really think it's one that we're looking at as being very useful because it actually gives you the trace minerals inside the cells, while the cell science test and the SpectraCell test are giving you what's in your white blood cells. And that's one of the great problems we have in medicine in general. When we measure things, we're measuring what's in the blood, and that's not necessarily what's in your tissues. We get into that problem with the vitamins. They can be high in your bloodstream, but that doesn't necessarily mean that they're really getting into your cells, or when they're in your cells, they're working well. Because if they don't have the trace mineral cofactors, high levels in the bloodstream doesn't mean it's working, they're high in your cells. So anyway, it's an interesting world, and I'm looking forward to more and more testing coming out that's going to be better. But for now, those are the three
Yeah,
that I know of.
yeah. So someone's asking about peptides for cardiovascular health. I'm really liking to use bioregulators for the organs. I don't know what you're talking about when you're asking about cardiovascular health. There's a variety of issues someone could have, right? So again, if you have a cardiovascular issue, make sure you've got your cardiologist on board. I can't stress that enough. But if you're looking for general supportive cardiovascular help with the bioregulators or peptides, there is a heart bioregulator there is the blood vessel bioregulator. Of course, I'm thinking about bringing inflammation down as well. That's when I'm going to turn to the peptides that help with that. So the thing about the bioregulators is that they're only between 2 to 4 amino acids in length, so they actually enter the cells as opposed to sit outside the cells on the cell receptors like our classical peptides do that are larger than 4 amino acids in length. So when they enter the cell, they're then working to heal that epigenetic expression that we might not want in there. They're working to heal the tissues of that specific organ. So that's why I'm talking about using the blood vessel and the heart bioregulator for cardiovascular, and then bringing down persistent inflammation in the body with, say, TB4 or KPV or Amlexinox. Um, let's see what else. Someone's asking about clearing mycotoxins from the sinuses. Can CMAX or C-Lank or any other peptide help? Thoughts on using amphotericin B and EDTA atomizer spray. Okay, so the sinuses, this is something I've been obsessed with for a long time. Um, sinus sinus health, because my patients typically have multiple layers of different microbes in colonizing their sinuses. I'm not talking about an infection, but a colonization. Now, when people have funguses in their sinuses, I find this a lot in my patients. If they've got that, then it's pretty possible and highly likely that those funguses those molds are creating mycotoxin. Those mycotoxins are crossing the blood-brain barrier and contributing to inflammation in the brain. So giving Cmax and C-Lank first, when we still have microbes in there, I've seen that just not work at all. We need to deal with treating those infections first. Usually I am atomizing an antifungal or an antibiotic, which includes a biofilm buster, because you asked about EDTA, I believe, in that question. So yeah, maybe I'm using bag eye spray, for example, if the patient has funguses in there and mark-ons and biofilm, that might be appropriate for that patient. So I'm killing off the bugs using an entire sinus protocol, which is I can save that for another day. That's a lot to talk about, my entire sinus protocol, but that's one of the parts of it. And then the next part, once I've killed the microbes, is to use Cmax and C-Link to that those will cross the blood-brain barrier and help to bring inflammation down in the brain. As for removing mycotoxins, we don't need to remove them per se because we're killing the bugs. We're then coming in with the peptides. This is something that Dr. Holtorf was talking a lot about in our webinar last week. It's not necessary to use binders all the time. Binders go for what's in the gut. And I like to use a combination of binders, but I'm not expecting those binders to clear up what's in the sinuses. So it's a multi-layered approach, and it's different for each person, but that's a that's a general overview of that.
Yeah. I'm just asking someone seems to be a lot of questions about protein metabolism that I think they're very interesting questions, but I really can't give you detailed answers on that.
So
It's
what was the
fascinating. No,
question?
they're just somebody's asking. I just feel bad when I'm seeing questions that we're not answering, and someone's has a lot of questions about protein metabolism that are interesting, but I really don't have the answers for. Um, which is always interesting. And um and people I'm trying to get
Someone's
some
asking about peptides to treat Raynaud's. So this is really about peptides to treat autoimmunity. So if you have Raynaud's, I want to understand why you have Raynaud's. What are the reasons? I understand that there's a confused immune system, and I'm going to work on that with the peptides. I'm going to work to calm the immune system first. I might use TB4, Amlexinox, KPV, Lorazepam. These are very calming. Same with TB4. And then I'm going to understand what microbes you've got that are causing the Raynaud's, because underneath almost every autoimmune condition, I would expect there to be a combination of um, multiple low-grade chronic infections and as well multiple low-grade environmental toxins. The Raynaud's is showing up in your connective tissue. That's the end site of uh, of the persistent inflammation causing immune dysregulation, which then we've got persistent inflammation and oxidative stress meeting the genes causing the Raynaud's, right? So I want to go downstream, modulating the immune system, but I want to go back a few steps. What do you have that's causing this? Do I need to detoxify you? Of what? Do I need to kill bugs? Which ones? And then it's very much a dance of the detox and the killing the bugs and maintaining the appropriate immune, I'd say dance with the peptides and bioregulators as we're treating that. There's no one size fits all for any autoimmune treatment.
Yeah, and that was just a beautiful answer. And I want to kind of play off of that because there's another question here. Someone asked, I can't digest anymore, as if the mixer function of the gut muscles are not working, creating gas, nausea, and even flushing. And they talk about having elevated gliotoxins, glycotoxins, probably
Glio, probably. I
probably
mean, yeah.
gliotoxins. But and they feel like the leaky gut was treated, but they still have chronic Bartonella. So if you got Bartonella, you still got an inflamed gut. Bartonella loves to live in the small vessels of the gut. So that's there. But it was just as Dr. Parpy was saying, is that this is a a very well complex and self lots of moving parts here because first of all when your gut's not working, think about your structure again. That's our next form, structure and neuroinflammation. It's really important and it's totally ignored. When your gut isn't working, remember you've got your vagus nerve and you've got from your upper cervicals and the mid-thoracic area is feeding the sympathetics that are going to those in your intestines and your gut and help controlling a lot of the function. So something is happening there that things aren't moving like they should. So get that checked out. And you still have plenty of work to do with your gut directly. And as we were talking about, the lorazepam, the peptides to help the leaky gut. But somebody also has to be paying attention to what you can do to the Bartonella if that is in fact causing inflammation still in your gut. It's not just the mycotoxins, that's the top level. But underneath that, there are multiple other players. And remember, going back again, your trace minerals and your micronutrients and getting them in. You might have to be using them sublingually or even rectally or IV if the gut's really a mess, just to get things back in order. So I thought we'd just take a little break from the peptides for a moment and let's continue
I'm
on.
enjoying the peptides part because I've devoted a lot of the last decade to studying them and using them deeply. So this is
Okay,
uh
that's
Eric,
good.
talk to them about plasmalogen. Someone's asking about
But
that.
plasmalogens help, and I'm not sure would plasmalogens help what. Plasmalogens will help a lot of people. Again, they are. I have found after you using them for a long time since before COVID anyway, and they are very useful to lower inflammation and to help the brain and help the nervous system heal. Okay, they're a very important part of your metabolism. But if there's a lot of inflammation in the body, after a month, if they're not working, you have to go deeper. Once again, it's not like the peptides are really talking to the immune functions. The plasmalogens are helping the membranes, which will modulate immune function. But usually, if there's a lot of underlying inflammation and infection, they're not the place to start. And so if they don't work for you, it's not that they're not working, especially if you've measured and you're low in them. It's just you have other work to do. You have to get to the other inflammatory issues. And that's where the peptides
Yeah.
maybe your best step in and then going back to the plasmalogens as you're healing.
Someone's asking what nasal spray I mentioned for fungal colonization in the sinuses. It's itraconazole. Um, so when I talked about Beg I, Bactroban, EDTA, gentamicin, Those three will take care of, sorry, the Bactroban and the gentamicin typically will take care of mark-ons and other bacterial infections that are found. The EDTA helps to bust the biofilm. The I in there stood for the itraconazole, which is to help treat the fungal colonization.
Yeah, well, that's an interesting
Which
question.
one?
The the taking the combination of KP of lorazepam, KPV, and BPC, and starting to recycle um, long COVID symptoms that were gone.
Interesting.
Yeah.
Okay. So here's the thing. Lorazepam, it depends what order you did this
No,
in.
but there
Okay.
was a combination
It's a combination. Oh, it's a
which
combination
formula.
formula?
Yeah, so that's
Oh,
where
formula. There we go. Sorry, I thought maybe they took them all in separate pills. Okay, so that means you started taking them all at the same time. For my patients with long COVID, I'm never giving them peptides all at the same time. We're starting with one at a time because you're highly sensitive. Okay.
but just I think this person is they were recovered,
They
and
were
these were
recovered.
old symptoms, and so but this is going to it goes to the
One
same
second, let me
point.
read the
Yeah, it
question.
goes to the same point.
Started, they started, one second, when I started taking oral combo of lorazepam, KPV, BPC, I started recycling
Oh,
that I thought were long gone. Okay,
uh,
okay. So I'm still answering the question the same
yeah,
way. So
yeah.
you thought they were long gone. So there was still something underlying, some low level, low grade of inflammation. Now, I'm assuming this was oral. Okay, so KPV, it has the properties of stabilizing mast cells, but it also has antimicrobial activity against a variety of staph species and also candida. So what I believe was going on is that the KPV probably started to work on your microbiome, and maybe you have a lot of candida. Maybe you had certain staph species in there and it was just too much. So anybody who has had long COVID or is in the middle of long COVID, I'm always treating them the way I mentioned earlier, one peptide at a time, because I don't know how you're going to respond. It's a little bit, excuse my voice, it's a little bit like walking on a landmine mine when somebody has just finished with long COVID, and particularly when they're still dealing with long COVID. So I think that's what happened.
Yeah, and so there's two questions related to cancer, and our peptides used to heal leaky gut inflammation, cancer, and remission. And yes, I would say peptides. The thymosin alpha has been used for cancer therapies at least I remember since the early 2000s. It was being imported from Panama back then, um, and so it is used for cancer. It's been used in the past for cancer therapy, so I'm not worried about it for that, and I can't see any problem with peptides. They're not going to yeah, cause cancer or activate cancer cells. Exosomes, there's another question about exosomes, and yeah, exosomes are not, they are anti-inflammatory information. And again, they're often going to get your immune system to work better and modulate it. So I have never seen an issue with that. There's questions around stem cells, and that there's no yes or no answer there. It really depends on the tumor and the type of stem cell. So that's a much longer discussion. But exosomes are not an issue that I've ever heard of.
Okay.
And,
Someone's asking about peptides. Erica, and I just want to
okay,
read the question
I didn't see
fully
this
before
one.
you. Um, I lost the question. One sec. Okay, here we go. Are peptides for managing high cortisol levels? Any peptides for managing high cortisol levels during afternoon, evening, and night? So I want to understand why the cortisol is high. I want to understand what your thyroid's doing because the thyroid and the adrenals are connected. So to give a blanket answer for that, of course, there's the adrenal bioregulator, which is going to help. There's there's epithalon, which helps with the hypothalamus itself. So it could help with the HPA axis. Um, but I wouldn't just throw these things at you until I understand what's happening with the adrenals, what's happening with your thyroid, what's happening with your sex hormones, and why this is going on.
Yeah.
Okay. And then I would give you the appropriate peptides and bioregulators and
Yeah.
hormones or
Yeah.
whatever else you need.
Yeah. I think that's just the most important part here is that these aren't meant to be band-aids. This is not, and when you have high cortisol, the question is what's going on in your life? What's driving that system? Okay. It's not something that just needs to be suppressed or just fixed. It's part of a system that is dysregulated. And, but the simple answer for nighttime is just phosphatidylserine will often it helps metabolize excess cortisol. It helps the biochemical process. But again, the more important thing is what else is happening in your body. It's not a thing to treat out of context.
Yeah. The context is everything, and it's different for each person. Someone's asking about nicotine helping spike protein get out. There's some research that shows that it does. And um, when I've used it with my patients and I've looked at their infectolab test, looking at the COVID spike protein test, sorry, not spike protein, it's called the SARS-CoV-2. Um, what's that one called? The SARS-CoV-2.
What are you
It's
looking
by
for?
it's by Infectolab, okay, and it is looking at if there is
T cell
it's the
activation.
spot test. It's called the spot test.
Yeah.
It's looking for T cell activation. So if interferon gamma is high, it means that there is spike protein or there is virus and it's in a reservoir. Okay, we'll never be able to tell you where that reservoir is. We don't have access to that information, but many of my patients have had a high interferon gamma a year or two after they've had COVID, and that tells me there's reservoirs of either spike or the virus. And when I've given nicotine and many other things to that patient, what are those other things? Maybe that patient needs some thymosin alpha 1. Okay, because perhaps it's actual reservoir of the virus itself. Maybe they need some LL37 to help perforate cell walls of uh, other infections. Maybe they need some vitamin E and vitamin C to help with the inflammation that could come when the spike is removed. Maybe they need some augmented NAC to help with the nicotine, or maybe they need the blood vessel bioregulator. What I'm getting at is it's not just one thing, but it's many things that
Yeah.
work in combination. It's like if like baking a cake. It's not just the flour, the gluten-free flour, of course. It's not just that, right? But if I just take the flour and put it in the oven and put some heat on it, nothing is going to happen. So it's using the appropriate substances at the appropriate time for that person. But yes,
Yeah.
nicotine can help, but it needs
Yeah.
many other things need to
Yeah.
be.
And just one of the comment here is the LabCorp test is an antibody to the spike protein. Okay, it's not telling you, it's telling your body's making antibodies, and that's to it. It's not really giving you a number of how much carriage your body has of spike protein left in it. Okay, these antibodies can be persisting even after the spike protein is gone for a while. But so it's an indirect indication. There's no regularly available test yet to measure just the spike protein itself in America. There's a lab in Germany that does it, and T-Lab has a research project on measuring it directly, but still not ready uh,
Yeah,
for use. And
I want to answer this
yeah,
question.
that's the
It's a great
that's a
question.
great question.
Yeah.
Yeah,
I'm going to read
absolutely.
it
Yeah.
first, and then I'm sure we'll both have answers for this. Okay. Do you find that as an overall, peptides can be a full replacement of herbs to treating Borrelia, Babesia, and Bartonella? For those of you who don't know, Borrelia is Lyme. Replacing peptides for cryptolepis, Japanese knotweed, red sage, redroot, Houttenia, Sida acuta,
Yeah,
wormwood,
go on.
black walnut,
So
Chinese skullcap, etc. So, um, I have an answer for that, Eric. You want to go
Yeah, no, no,
first?
no, I
No?
mean, this is a straightforward
This
answer,
is
I think.
straightforward,
Okay.
and it's not, okay? So, I'd say for the past 8 years, I have had peptides at my fingertips, and I've been using them extensively for my patients who have complex chronic illness. I'd say probably more so than anyone except for Kent, the two of us have been the ones using them deeply, okay, for this patient population. Now, I have noticed that over the past 8 years using them, I have had to use the herbs less and less. Before 8 years ago, when I did not have peptides at my fingertips, I was leaning on those herbs to treat my patients with those infections. That's all I had. Okay. And so, somebody, you might have heard me say this before, whom it would have taken 5 years to treat at that time. Now I add the peptides on, it cuts that time in half. Okay, someone whom it would have taken 2 years literally could take 6 to 8 months to treat with the advent of peptides. So I'm not using them to replace, I'm using them in conjunction with. And that is the beauty of peptides, that we can give our patients their lives back much quicker.
Yeah, the bottom line is peptides will augment your immune function, but if you really have significant bacterial load, you often need to treat them. Not, you know, I mean, say we always like the cases when we kind of replete the gut heals and we replete the immune system, and then you're back to being a person who is able to deal with the infections. But if the infections are deep in you and they are really a big cause of why you kind of fell off the cliff, then you better treat them. Because even if your body gets them back under control, the next time you get stressed or have they might pop up again. So, I
Yeah.
mean, and this is a great dilemma in the world of Lyme. Can we and do we have to eradicate these bugs, or can we just get the immune system back in control? And it's a very, I said, I don't have an absolute answer for
It's a
that.
little bit of both, I'd
Yeah, well,
say. Yeah.
it depends on the person, and we still don't know at what level your body containing these infections for a lifetime is going to lead to a chronic level of increased immune function that's going to affect your brain function over time, or not. You know, and so we just don't have those answers. So what we do is look at the person and look at their family histories and do our best to if we can eradicate the bug. I still think that's probably your best bet, but you have to see what your immune system can do and how much your body you're willing to play that game of like taking the herbs or taking antibiotics, and versus the downsides of them of taking those drugs or herbs versus taking your chances that your immune system is not going to be overreactive and you're not creating inflammation in your brain. Hopefully, I said our tests are getting better, and hopefully in the next year or so, maybe sooner, we'll be able to make those judgments. But at this point, it's not a straightforward answer, as everything in medicine. Okay, so
Okay, someone's asking, are there peptides and or herbs to treat severe EMF exposures? Not directly. Okay. If you've got severe EMF exposure, I need to know why. It's different for each person. But what I found is that patients who have a high level of metals, usually I'm finding mercury, lead, arsenic, aluminum, cadmium, high levels of that, and high levels of mycotoxins, this patient population is more prone to EMF sensitivity. So, of course, I'm doing what I do, which is to modulate the immune system, okay, while I'm dealing with the causes. And then we see our patient's EMF sensitivity go down.
okay, that's just easy question is, have you treated Bartonella successfully without antibiotics? Yes, there's lots of things that treat Bartonella without antibiotics, but again, it depends on your body. Just because we antibiotics, herbs have definitely worked well. We have seen cases of SOT working, true dose working, um, but we've also seen it fail. So, I mean, you just have to understand that it's your body and the bug. It's not the bug. People will make claims, oh, this treatment is going to work. And the answer is sometimes. I wish people would just get used to that idea that your body is your body. And when you have a chronic infection, it's your individuality that's coming out, your body's compensations that are coming out. It's not when you have an acute infection, you have pneumonia or bronchitis, and you can take an herb or an antibiotic and the response is rapid, okay? And that your body is playing a role in that, but if the herb or antibiotic works, it's quick. But let it hang around for 6 months, and now it's compensations, and that's your system, and one size fits all is not working anymore. And that's our what I'm trying to get across in these talks all the time is that what works for the thing in the moment, the infection, the injury that happens and your recovery in 1, 2, 3 weeks is a totally different animal from what happens. You have an event and you're not better after 6 months or a year. So totally different, and understand regular medicine and acute herbal medicine is wonderful for the thing that's going to get better quickly. But if it doesn't, then it's a lot more work to be done, and it's about your body, not what you're reading on the internet.
So beautifully said, Eric. Yeah.
Okay.
Um, Someone is asking about peptides for hair loss and Alzheimer's. All right, back to what he just said, right?
That's an interesting combination,
Now
but
here, now here's the thing. GHKCU can help with hair loss from the compounding pharmacy. You can get a foam for the hair. Uh, but why is it going on? Alzheimer's, I'm going to go right back to the way Eric answered that question. No, I'm not going to give someone a peptide. It would be a waste of your money and unfair to you to say, take this peptide. It's going to cure your Alzheimer's. Absolutely not. Nothing on its own is going to do that. So again, we have to understand why this is going on with you or your loved one. Why does this person have Alzheimer's? So looking at all of the multiple uh, causes, okay, looking at the downstream compensations. And yes, there are certain peptides that can be given for brain support. There's dihexa, there's cerebrolysin, there's um, CMAX, C-Lank, so
yeah,
oxytocin. So all of these peptides are going to help with the brain. Exosomes are going to help with the brain. Okay, but I wouldn't
yeah.
just hand
Well,
you these things. It's a waste of your money without understanding why
yeah,
this is
why,
going
why,
on.
why the persistent inflammation? Because I mean, people argue, the whole story with Alzheimer's and amyloid and tau. I mean, and these are all chemicals, I mean, well, proteins and that are produced in the brain in response to inflammation, in response to infection, and they're protective. It's only when we keep making them that they're a problem. So remember, at the beginning is inflammation and how your body responds to it. Again, okay, because you can have a ton of amyloid in your brain and not have any problems with your cognitive function. It, so it's how you got there and what's happening in your body. And again, I don't want to be, but this is a good example of where peptides might come in handy. A patient with ME/CFS and reactivation of EBV, and just an aside, just because the titers go up, like what they call the nuclear capsid and the viral coat, the VCA, and even the early antigen, these are all antibodies that can go up very high in people with ME/CFS. It still doesn't mean that there's a reactivation of the bug, because when we look for the DNA of the bug, we often don't find it. Sometimes we
Using
do.
using Infectolab, looking
Or
again at T cells, interferon gamma, interleukin 2, that's my go-to. If it's questionable when I'm looking at their antibodies, and I always am for my patients, I start there. If it's obvious by their clinical history and their antibodies, a combination of that, okay, then I know, sure, that's reactivated. But if it's iffy, I don't know, then I'm using Infectolab, looking at interferon gamma and interleukin 2. That will tell me if
yeah.
there's an infection right here, right now.
But anyway, the thing is, it's immune modulation usually, because anytime these viruses live in your B cells, they're immortalized in your B cells. So if you had mono when you were, well, people have EBV usually at 1 to 2 years old. In most of the world, in America, because of our isolation, we don't. So people get it often in college, and then we call it mono. But once you have it, it stays in your B cells and some of your B cells. And when these B cells replicate, occasionally you will release a few of the proteins that will set off these antibodies. It doesn't mean the virus is, but it's not active. It's just making a few proteins. Okay. And that's getting your immune system activated. And sometimes you actually can have a reactivation. The bottom line is to this question, though, is this poor person, worsened with IV vitamin C? And often IV vitamin C can be helpful to get your immune system to deal better with this, if not reactivation, but just reproduction of some viral proteins.
Mhm.
And in this case, it's not. And this goes right back to what Dr. Parpia is talking about. And I'll throw it over to you again. Would peptides be helpful?
Okay, so first of all, I'm also thinking about the IV vitamin C. So if it's a high dose of IV vitamin C, which I'm thinking is what's going on, because that will kill infected cells. Okay, and a lot of you might have heard of a Herxheimer reaction. So a lot of the times our patients are not ready for the oxidative therapies, those therapies that are going to uh, kill infected cells or kill the infections. So I want to slow down. That gives me a lot of information. If a high dose of IV vitamin C is not working for you, slow down. Let's modulate the immune system so that you can deal with that. And so, yes, peptide therapies are going to be very helpful to modulate the immune system. And and I would use when the time is right, I might bring on TA1 and I might bring on LL37. I might bring on other herbs or antiviral medications, a combination of these things. This person is bedridden. We have a lot of patients who are bedridden, and yes, we work with them. Um, at some point within 6 months to a year, we need to have a physical exam, and there's a lot to,
Yeah.
that's open up a whole nother question. Just, you can call the front desk. Sorry, you can go to our website.
Yeah.
I lied. Do not call the front desk. Go to our website. You can click on the link to become a new patient, and that will then in turn get you to our new patient coordinators who can answer your questions about particulars like that. What if someone is bedridden? How do we work with them? There's a whole way to
Yeah.
do that. So
Yeah. And someone's mentioning IV laser, the Weber laser again, but it's the same problem. Is you're trying to kill or activate the immune system when it's not ready. Okay. And that is often the problem with chronic fatigue and with chronic Lyme, any of these persistent infections, is that if you try to kill something, okay, or activate your immune system, not necessarily kill, but activate, and you have a bad response, it means you have to step back and you have to balance the system. You have to get to different levels, whether it's a bigger toxin load. There's something there that's causing this. It's not looking for a better way to keep activating the immune system. It's teaching you a lesson that you someday you can get there, and these more aggressive therapies will be the right thing. But right now, it's looking a little deeper at what's keeping your immune system sort of, that is what Dr. Fee said, that hyperactive and underactive at the same time. So you're reacting inappropriately and you're not able to turn it off quickly.
okay,
Yeah.
so someone is asking about what we can do for small airway diseases, fibrosis from asthma. So glutathione is a peptide. People forget that. We have patients in our office nebulize glutathione, and it's got to be from the compounding pharmacy. It's got to be in our office, and that has really helped them. Okay, let's look at, someone is asking, as women age, learning that they are so much more prone to HPV reactivation, not just HPV reactivation, but reactivation of all the herpes family viruses. I've seen EBV, CMV, HHV6, HHV1 and 2, okay, reactivation of mycoplasma, chlamydia pneumonia. I've seen that reactivation of tick-borne diseases. So it's not only HPV reactivation that women are prone to post-menopause. Um, So the rest of the question is, and if aggressive, I am seeing HPV cancers. Can peptides help here, or any other ideas for these poor women? So when it's appropriate, I'm giving my women patients bioidentical hormone therapy first because without enough hormone on board, we're actually having I'd say suboptimal uh, a suboptimal immune response because there's crosstalk between the immune system and the endocrine system. So when we're depleted of our hormones, the immune system suffers. We don't have enough progesterone. We're going to be more prone to persistent infections. Not enough progesterone. We're going to be prone to not sleeping well. Okay. Too much estrogen just means there's not enough balance of progesterone and estrogen. People who have too much estrogen, meaning estrogen dominance, they're more prone to mast cell activation syndrome. So all of these things are going to have this impact on waking up, so to speak, dormant infections, not just HPV. So the first thing I'm doing is getting them on bioidentical hormone therapy, assessing the rest of their terrain, okay, working on the gut if there's persistent inflammation in the gut, and parasites, funguses, a microbiome that's inappropriate. I'm working on that because that's also going to contribute to immune system dysregulation. So I'm hunting throughout the whole system what is causing immune dysregulation in these women, in addition to not enough hormone. I'm working on those systems, and peptide therapies, of course, they come in, right? There's peptides to modulate the immune system, peptides to help with our hormones. For example, epithalon or the pineal bioregulator, kisspeptin is going to help with the hormones. So you're hearing me say these names, don't just go and get them and use them. You want to use them you want to use them with an experienced doctor, okay? Who's someone who's experienced with working with the entire terrain of your system and hormones included, and then weaving the peptides in and out. Okay. So that's my answer to that.
Let's see. There was a random question. I mean, random only because it's been peptide world asking about uranium and thorium and binding it. And basically, active chelation for uranium is probably not a grand idea. We don't want to concentrate it in the kidneys, which sometimes can happen with the chemical chelators. There's two of them that are used sometimes, but probably the best thing for those are using the chlorophyll-based things. There was actually research from years around Chernobyl, like using was it brown seaweed, I believe it was, but probably any of the seaweed products is, but you just want to make sure that these are ones that are checked and make sure they're not high in lead and mercury at the same time. But those will safely lower uranium over time, and it was found on a hair test, and it often is just it's environmental. I mean, usually you'll find that in the I know like in the mountains, uh, in the western eastern. And we're in California, so the mountains are in the east here. On the eastern mountains, there's high levels of uranium in the groundwater, so it's a thing. So good to check for. Um,
Here's one. Someone says, I
yeah.
think it's a doctor. I'm a firm believer that just the LL37 alone won't kill all the bacteria and biofilm. Yes, I'm a firm believer of that too. Okay, let's say the client has SIBO or yeast. Is LL37 just going to bring in after the gut protocol with the antimicrobial herb supplement protocol? Yeah, I'm going to bring in the LL37 after. Typically, I want to treat the SIBO first. I want to understand what's going on with the gut. I'm bringing in LL37 along with thymosin alpha-1 further on in treatment. If all they have is gut dysbiosis, then they're lucky. Most of my patients, that's just one thing they have. They've got multiple other things. So I'm not using TA1 and LL31, LL37, particularly for the gut. It's coming in for the other persistent chronic infections they've got.
Okay. Oh, I didn't. I forgot to say, with the airway issue, I would say if you're worried about fibrosis, that's where KPV probably can really be
Oh, yeah.
helpful. And also an oldie but goodie is, I mean, this is where VIP actually shines. Actually is really, really interesting for fibrosis. But it's, fibrosis shouldn't be happening from asthma. So there's something else going on that should look in a little differently. Um, but something there. And a specific NAC brand you recommend and any peptide alternatives. At this point, we've been using the augmented NAC.
What's the brand name again?
That's
Is
that
that the
I
brand?
think that's what they
I think
call
so.
it.
It's from Italy.
And we believe I'm waiting. They were going to release a urine test in America. I haven't seen it yet. Perhaps that would so we could actually measure the changes in spike protein coming out in the urine. I'm not aware. You might want someone out there might want to check that out or reminds me. We will check it out and see if that's available because it would be really nice to know. We're going on people's claims. They've written articles and we believe them, but it's nice to see the data or see the real testing to know for sure. It does make sense. And I said a lot of people who I respect have found it to be very helpful to use this augmented NAC as a better binder for spike protein.
Someone's asking about equipment I like for the sinus rinses. So I like the NasoNeb. The Rhino Clear Sprint is also good. Sometimes I've heard patients say the Rhino Clear clogs up. So I've been using the NasoNeb more. It works well.
And coming attractions, you will be talking about this in probably a webinar in the next few months. We're working with a company that has developed unfortunately, a very expensive, but one that needs to be used for a much shorter period of time and much more effective to get medications into the sinuses and even into the brain across the olfactory plate because the average, all those things we spray in our nose often uh, don't go much farther than here and they go right back into the back of your throat. They very rarely get into the sinus as well. That's been our problem. We do our best with what the technology we have, but there's something very new coming out and hopefully we'll be doing a whole
Don't ask us yet what it is.
well,
We
just because
cannot reveal it yet.
well,
What
it
it
is
is.
what it is. We have to make, again, people make claims and this has good data and published papers, but we really want to make sure that things work. Um,
So give us some time.
but it's coming, it's coming. Um, so, and what peptides would you use to help improve bile flow? Oh, bile, I guess it means bile flow in addition to TUDCA. Hadn't quite thought of that.
I would definitely give the liver bioregulator.
Yeah, I'm just thinking any peptide in particular. Well, again, I think, going back to the old story, lorazepam, if your guts healthy and not leaky, you're going to take a huge load off your liver and there's going to be a lot less
Absolutely.
toxins and your bile is going to be much healthier. Okay, that's a huge problem. When you stress your liver, you stress your gallbladder. And so working backwards, lorazepam and the other peptides, one by one to and the other things that you do. Because remember, it's not all peptides. Peptides are very useful, but they're only part of the story of rebuilding a gut. I wish it was everything was
Anyways, we
peptides.
are now at the end of the hour.
Oh my
So
God.
it's time to
Okay.
wrap up.
Um, and just see if there's anything
I
here.
think we need to do another one on peptides
Yeah, it looks like
in a couple
peptides have a
months.
lot, and to the nice person who keeps asking about the proteins, it's something I know enough about to give an answer, but it might be the wrong answer. So I would like to check before I start spouting off about protein metabolism. I think I have the answers, but I'm not sure. So
Coming attractions again.
I'll try
Okay.
to answer that one
Thank you
for you.
everybody for
Thank
joining us. Yeah.